piece of cake. Awesome. These are all my members. If you're wondering why I'm wearing this funky shirt, I have all of my members right now as of this date. It was like 2/2/20. 20. I was like,
yeah. I know, I feel like I have like the cold sweats. I'm like getting ready. I'm like, jeez, okay. No. Yeah, like I'm not nervous about being adjusted or anything, but I'm just like...
The YouTube thing?
No, like that doesn't bother me at all. I've just watched the videos. I'm like, oh God, I think this will be good. It's gonna be a good pain, I feel like. Like I'm gonna take it.
I will push you.
Yeah.
So you're a hairdresser. How long have you been a hairdresser for?
I've been behind the chair for 5 years now.
You have this torn labrum in the right shoulder. Now, when did you notice this pain start?
When I started getting really busy behind the chair, by having my arm up all the time, it became like unbearable to where I had to like have someone help me blow dry and everything. And that's when I finally got an MRI. They were like, yeah, it's torn, but they didn't say it was like anything insane.
Can you pinpoint it, or is it just the whole thing?
Honestly, it's almost like a burning sensation. Sometimes it's like a stabbing pain, but it depends on how much hair my client has. Because if it's a lot, then I'm like dying. Most of the time it's here, and then it kind of comes back this way. Not really ever in the front.
Anything else? You said headaches.
I do get headaches. Lately I've been getting like very sharp headaches like in the bottom of my neck.
Okay.
On both sides.
And then you're saying you have some mid-back pain as well?
Yeah.
Does that have a side?
Mostly on my right side.
I'm going to check your posture here. That tells me a lot. Kind of do one of these things.
I definitely stand like this when I'm working. Like this is like my comfortable spot.
Okay.
Well, yeah, whenever I'm like layering somebody, I'm this way and cutting this way. So I'm always like stepping into it. And then when they're here and you're trying to foil their hair, you can't like stand in front of them this way because I don't want to be like straddling them. So I try to stand
just
like...
put a mask on their face.
I try to stand like off to the side and be here. You know, for real. Like, I'm literally like right
you
here.
You should see what I do to you guys when you're down in there.
Put your face down. They're like right here. Like, geez, look down. Just look down. Don't look up.
Okay, press up for me. Any pain when I do that?
No.
Okay, and then we're going to do thumb down. Any pain when I do that? Just weakness.
A little in the back.
In the back here.
Yeah.
Yeah, I was fairly certain that this is where it tore.
Yeah.
Okay. Now when I go like this, any pain?
No.
Any pain when I do that?
A little.
In the back here?
Yeah.
And have it in the eye, push it towards the front?
No.
No. Okay. Test your reflexes really quickly. Just make sure that this isn't... Woo! Very good. Very good. You operate normally. I'm making sure that things from the brain to here are still intact.
Yes.
Okay.
Yes.
Test. Well, I'm just kidding. I'm kidding. There you go. Very good. It's usually my fault if it doesn't go. Very good.
User error.
Yes. They're a little bit more brisk on this side.
Okay.
Okay. There is a difference.
Okay.
So that leads me to think, okay, neck.
Okay.
I've got to check this side. Yeah, I mean, whew.
That's gnarly right there.
Look at that. Ugh. There you go. Okay, here's, hello, C2, look at that. Ooh, breathe. We knew it was here. Look at all that. Too much?
No, you're okay.
You just tell me. Because see how that doesn't have the same range of motion as the other side.
Oh yeah, it's like right where your thumb is.
C2 is the worst, yep. It's just like a gutter. You're going through a gutter and you're cleaning out all the leaves and all the gunk. This is where all the nerves exit. And we're going to go back and wiggle. Get it. All right, here we go. Right here, now drop that right shoulder. Perfect. That was 1 and 2. Great job. How'd that feel?
Good.
Are you okay?
Yeah.
I see you kind of like, still alive? Yes, I'm still here.
I'm just surprised it cracks. I've never been that person that can crack their neck.
Oh.
Like, I don't know, like, you know how some people can literally just, like take their face and just, I'm like, what? Like,
well, it's okay that you're not that kind of
yeah.
person. Perfect. That was a piece of cake. Awesome. Okay, so for this, we're just going to let it drain.
Okay.
Because that first, 5 to 10 minutes, all of that lymphatic tissue drains.
Cool.
Okay. Very good. Ooh. Wow, I even got the tiny ones.
I cracked my toes a lot.
Now, I wouldn't be surprised if there was less on this side. You understand?
Besides that one.
Besides that one. I do have to pull a little harder. This is where you place your weight, and sometimes that side is not as easy. See, even the ankle. How much can we get on this thing? Oh, she's not quite ready for that one. Come in here. Wow. Is it too much? I went right into it. I'm sorry.
No, it's okay.
I went right for it. I kind of hold you guys.
Because I'm like trying to lean away from you.
Yeah, as I hold you. I'm so mean. There it is, there it is, there it is. Okay. All right. Ooh. Put your hand on your hip like this. Very carefully. I'm going to see if I can get some range of motion. Push your elbow back into mine. Okay, that was the front. So, perfect. Now you get to go down into the hole and we can't see your face. Linnea's like, can you crack me later? She's cracking everything. Woo! That's where it gets intense. Okay, breathe. That's it. Right there. I gotta work on you.
Like my eyes start to water. I'm not like crying, but my eyes like water. I'm like, oh God.
We just know where to push. So this is the tricky thing. I kind of get like right by your neck and push. Okay. Ooh, deep breath in. All the way out. Good. All right, just making sure. If it's gonna pop, I gotta get it the right way. You gotta rib out over here. Oh. No, deep breath in. All the way out. Like that. This feels good. A little bit of a knot right here. All right, deep breath in again. I'm gonna get all of these and out. Good. I know. And again, that's the one that I already got. Yep, perfect.
So crunchy.
Yeah. We can hear all the scar tissue. We can hear and see your pain. There you go, other side. And very carefully take your arm back. Okay, does it feel okay like that? Mm-hmm. I'm not gonna push on your shoulder at all. I'm here. Breathe. There it goes. There it goes. Down now. As long as we can release the scapula from the rib cage, we're okay. Back it up. Careful, careful. Oh, that was the rest of your shoulder. This side you think is worse, eh?
Yeah.
Piriformis. Let's check it. Perfect. Good, 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 good. Done.
Yeah, this side is definitely hurts more than the other one.
Good, breathe. Exit. I'm just on this SI joint here.
I do get a little, I forgot to mention, I'm that person, sciatic nerve pain on my right side too.
Ah,
Just
now
I
you
know,
tell me.
I know. I was like, I'm gonna be that person. I forgot.
It's okay. Why do you think I check anyway? Okay. Because people forget. Piriformis release. Here we go. Get rid of it. Let's get rid of it. Yeah, it's all crumpled over here. You're like, why does it hurt more? There you go. Okay. Good. Ooh, there was a little bit of adhesion over here on the right. Okay, we got it.
Watched
like
your
a-
video and I'm like, I wonder what that feels like. I'm like, all right, well now I know.
It feels like a pinch. It feels exactly what it looks like. Like a pull. I mean, I can see it. You see this lump here? I'm not sure if you can see it on the camera.
You can try like getting the camera like here.
Right here. It's right there. Hi. Every pass should get a little easier, but at the same time I go a little deeper. There it is, that crunchiness. Yeah, I know you feel it. That's your scar tissue. Those are adhesions. Hey, it's almost out. There, it glides. Okay, as long as it moves, we're fine. Breathe. And I'm holding you because I'm doing a skin pull, but tissue pull. Okay, I'm gonna have to hold you there. We're gonna scrape all this, okay? And a lot of this goes away with the scraping. Those little pebbles. I'm just getting a little bit deeper layer here. See if I can't move it before we go and scrape the rest of it. How are you doing?
Good.
Okay.
That last little nugget.
I didn't realize it was there because I was so focused here, and now I'm like, crap. I gotta bring it out to the acromion process. I told her this was it, and I'm like, no, I missed one. This one I can just do trigger point therapy is what they call it. 1, 2, 3, and off. 1, 2, 3. 3? 4? Oh, there it goes. Ugh. This one has some grip on it, this myofascial releaser. But I'm interested to see how this edge works compared to their other scraper. It's a little bit more heavy because it doesn't have the holes in it. So we'll see. It's kind of cool. Oh, she's got 2 ribs. No, 3. 1, 2, 3. Right there. Oh, maybe possibly a 4th. Jeez, we haven't even gotten to your upper back. Does it hurt?
No.
It's just, I mean, I'm sure when I go out on these ribs, it might be a little uncomfortable.
Yeah, it's like a teeny bit tender.
Yeah, here's your rib. Ooh.
I can feel that.
Yeah. This is where it starts. And she's got all this over here. Okay, that was the low back.
Gross.
It's all right.
It just feels like, I don't even know what that feels
It's like gravel.
Yeah.
It's just, it goes away. You want that to come to the surface. You don't, it's blood that's sitting in there, because why doesn't it come out everywhere I push? Why does it only come out in patches? Because that's where the scar tissue is, and the blood doesn't circulate that well there. At least that's my theory. I'd be happy to test it, send it off to a lab. Ugh.
Ooh.
Hi. Hello. Oh, you can see the band. You can see this band of scar tissue right here. Their neck. Oh. I think that's amazing. Yes, I heard that. This one here on her. People was like, how can you do that? My mother-in-law's like, how do you just crack people's bones? And she's like, how do you do that? I'm like, I don't know. I'm not fazed by it. I've seen my dad do it my whole life. So to me, it was always fascinating. It was never, like, what do you think, Linnea? It's not like something that's freaky to you. Like, we had a guy last week that was in so much pain.
Oh, no.
She was just like, oh my God, that was painful to watch. And Linnea's like, eh.
She's like, I've seen worse.
I've seen worse. Yeah. Yeah, we're not really fazed by it. I'm so used to it. It looks pretty bad. But don't be scared by the pink stuff.
Okay.
It's just the purple.
Oh, yeah. Looks good.
I mean, there's just these bands here.
Mm-hmm.
You know, this is like a general sweep, but this side had like bent, like
Mm-hmm. Layers. And
yeah. And head back for me. Perfect. That's all it's gonna go. Other side. No, I don't know if this is gonna go, but oh, it did nicely too. I'm actually working way more on this side. Lean away. This is the side that needs it. Feels fine. Everything feels great. All right, so a little bit of tightness here, hey? Yeah, your pec minor muscle there is awfully tight. But,
what are you going to do?
I mean, well, I'm going to show you what you're going to do. I want you to do it every day. But it's because you're working like this.
Yeah.
So that's why I want to take you back and open this up and see if we can't stretch this whole structure here.
Okay.
All right. So how do you feel?
I feel
You're
good.
on the spot.
I know.
You said before like you were a little sore.
A little sore. So I feel like I got beat up a little.
You
I
can tell me.
But I
You
like
can
it.
tell me.
Like, it feels good. So, like, I'm not mad about it.
Okay, and how about that shoulder? Your right shoulder, that's what I'm worried about.
Feels good. Like, I feel like I can move it around.
Okay.
There's just, like, obviously it's a little sore.
Right.
But,
Get dug into you.
Like, I feel like I can, like, move. And I'm not, like, here.
Okay,
like,
good.
trapped.
Yes. That's
Yeah.
what I want. Right
Yeah,
there.
I
That
feel like I
last
can, like,
little move.
Open up a little bit.
Yeah, that last little click.
Yes.
You know, where the shoulder goes back. Yeah.
Yeah.